Hmm. Hello guys. Today we are going to learn about drugs involving in osteoporosis. Okay, so we have two types. One that is decreasing the bone resorption and another one that is increasing the bone formation. So for bone resorption to decrease, we have to use two drugs, bisphosphonates and denosumab. Okay, so guess guys, what's the action of bisphosphonate? So the bisphosphonate, it inhibits one enzyme, okay, farnesyl pyrophosphate synthase. So by inhibiting this enzyme, it helps in osteoclast apoptosis. Osteoclast cells, right? This only that involves in destruction of bones. So it helps to apoptosis of the osteoclast. Which enzyme? Farnesyl pyrophosphate synthase. Okay, bisphosphonates. Then next, denosumab. It is an antibody. We all know, right? Monoclonal antibody. So what this does? For this, we have to understand one basic. Okay, this is osteoblast. Osteoblast has one ligand, that is rank ligand, and which attaches it to a receptor, rank receptor, which is present in osteoclast cells. What do you mean by osteoclast? These are multinucleate macrophages, right? Okay, so rank receptor, which is present in osteoclast cell. So osteoblast will help osteoclast to destroy the bone, right? Because we have to maintain the bone by bone formation and bone destruction. So osteoblast activate the osteoclast. It's a main mechanism. Okay, so the denosumab, which mainly inhibits what, this rank ligand. Okay, so osteoblast won't activate osteoclast, so osteoclast don't have the work to destroy the bone, right? Okay, common. Next, increase the bone formation. So what are the drugs we have to do? Teriparatide, abloparatide and romosumab. So teriparatide means is a PTH analog, parathyroid hormone analog. Abloparatide is a parathyroid hormone related peptide analog. Okay, next, romosumab is also an antibody which mainly blocks one protein called sclerostin. So parathyroid hormone, just keep it, no need to go inside. Okay, just keep in mind that parathyroid hormone mainly it involves in bone formation. That's enough. So these three drugs help in bone formation. So what are the conditions we have to form a bone? Already there's a fracture, right? And post menopausal there may be osteoporosis. So these are the conditions we have to use these drugs. Okay, next, both common property we have strontium ranulate, that much. um, if we go into detail, bisphosphonates, we have mainly four types drugs like alendronate, risdronate, pamidronate, zoledronate. Okay, oral IV like that. For IV purpose we are using pamidronate and zoledronate. Drug of choice for osteoporosis and also for Paget's disease. Why we are using in Paget's disease? See, Paget's disease is abnormal activation of osteoclast cells. So here we are inducing the apoptosis of osteoclast cell. So in Paget's disease we are using bisphosphonates. Okay, and also hypercalcemia of malignancy. So if you are not destroying the bone means, so there is no calcium, right? So hypercalcemia of malignancy also we are using bisphosphonates. So the main side effect is esophagitis. So for it should be reduced, right? So we have to take the tablet on an early morning, that is empty stomach with more water, and we should not lie down for 30 minutes to prevent the esophagitis. Next, osteonecrosis of jaw and bone fracture. These are all side effects, okay? Esophagitis, osteonecrosis of jaw, and bone fracture. And we have teriparatide and abloparatide, right? So, abloparatide, main side effect osteosarcoma. So, we should not use this in Paget's disease because Paget's disease itself causes osteosarcoma because abnormal activation of osteoclast cells, right? So, we shouldn't use that drug here. That much understood?